what body does to the drug.
Okay, our subject today is part of pharmacokinetics component. Okay, what body does to the drug. Okay, so the pharmacokinetics consists of drug absorption, distribution, metabolism, and excretion. So today we will learn the half of the pharmacokinetics, which is the first two parts, which is drug absorption and also distribution. So the learning outcome, I hope you will understand the pharmacokinetic process in terms of the absorption and distribution. Understand the mechanism of drug absorption and distribution. Understand the factors that affect absorption and distribution. Can define what is bioavailability and also the first pass effect. And lastly, you can define what is volume of distribution. These are the components of pharmacokinetics. Okay, the definition of absorption. It is the transfer of drug from its site of administration to the bloodstream. Okay, you see here the drug molecules need to travel through the mucous layer. This one is oral drugs. Okay, mucous layer of the stomach, and then water layer, epithelial layer, basement membrane, and then to capillary. So IV, intravenous or intraarterial, it can bypass the absorption because the needle will bring the drug straight away to the blood circulation. Okay. So this is the first pass metabolism or liver metabolism, as we have discussed on Monday, right? Remember hepatic portal vein? These are the veins that connect the alimentary tract or GI tract, okay, any component inside the GI tract straight to the liver. So in the liver, the drugs will be filtered, okay, or metabolized and then excreted back to the blood circulation. Okay, so normally for drugs or oral drugs, okay, that enter the GI tract first, it will undergo metabolism by the liver first. Then usually the unchanged drug that goes to the circulation after that will not be 100%. Okay, for example, 100 milligram we ingest or we swallow the drug, 100 milligram, for example, when it enters the GI tract and then go to the liver, and then the unchanged drug, okay, will not be 100 milligram anymore. Maybe it will be 80 or 70 milligram only. Okay, that goes to the bloodstream. This is called first pass metabolism. The mechanism of drug absorption. The absorption of the drug can occur through three types of ways. Okay, the first one, passive transport, active transport, and endocytosis or exocytosis. I'm sure you already know this term, right? During your secondary school or matriculation or STPM. Am I right?
Yes.
Yes, doctor.
Example of endocytosis. Can you give examples? You remember macrophages?
Engulfment of bacteria.
Yes. It is by endocytosis or exocytosis?
Endo, since we are absorbing it.
Yes, thank you. Okay. So we go to the first one, passive transport. It is through diffusion, whether through diffusion or facilitated diffusion. Okay. For diffusion, it uses the concentration gradient across the membrane, does not involve carrier, and majority of drugs are absorbed through this way. Okay, the second diffusion is the second passive transport is through facilitated diffusion, which use transmembrane carrier proteins. You can see in the picture here. You need this one is diffusion. Okay, does not require protein membrane or membrane proteins, but facilitated diffusion use transmembrane carrier proteins. Once the drug binds to the the ligand you dengar tak mesej rumput? Sorry
Tak dengar.
Okay, so once the drug bind to the any sites of the protein will undergo conformational changes and will make an opening for the drugs to be diffused to the other side. And passive transport does not require ATP. Okay, active transport usually need energy or ATP. It also involves carrier proteins, and active transport can bring or move drugs against the concentration gradient. Okay, for example, anti-cancer drugs, 5-fluorouracil. Okay, so this one require ATP. The third one, endocytosis, exocytosis. Example, for endocytosis, the vitamin B12, okay, it is transported across the gut wall through engulfment of drug molecules by the cell membrane. Exocytosis, example is like neurotransmitters like noradrenaline, which is stored in vesicles in nerve terminal. It will be released to the junction or the end terminal to the ruang antara ruang outside the terminals through exocytosis. Okay. Do you still remember the neurotransmitters, the nerve terminal? Okay. So we go to factors that influence the absorption, the pH and lipophilicity of the drugs, the blood flow of our body, the expression of P-glycoproteins on the site of absorption, and then the contact time at the absorption surface and total surface area available for absorption. Okay, we go one by one. The first one, pH and lipophilicity of the drugs. Okay, unionized or uncharged drugs like weak acid or weak base. Okay, example weak acid, the drug pentobarbital and aspirin. The weak base, theophylline, caffeine, and codeine. Okay, unionized or uncharged drugs are highly absorbed. Okay, compared to ionized or charged drugs. Okay, like strong acid, like disodium chromoglyte, and the strong base, guanidine. Okay, this one have very low absorption. Based on mode of administration, yes, on Monday, which drug do you think administered through IV? Ionized drug or unionized drug? Anyone? What type of, okay?
What's the question, doctor? I'm sorry.
Okay, on Monday, we learn about mode of drug administration, right? So, what type of drugs that can be prepared through IV, and which one is more suitable to be prepared through oral? Drug yang low absorption, usually we prepare by anyone?
By IV.
Yes, that's right. So kalau yang highly absorbed, it can be prepared through IV, IM, oral, yeah, subcutaneous, ataupun we can like implantation. Okay, those are for drugs that is highly absorbed. Kalau low absorption capability, we prepare it through IV. Okay, lipophilicity. Lipophilicity of the drugs. Okay, unionized drug have sufficient lipid solubility so that it can cross lipid bilayer of the cell membrane. So it can be absorbed into systemic circulation. However, drug should have sufficient aqueous solubility or hydrophilicity, right? Sufficient or a bit of aqueous solubility to dissolve in the fluids at absorption site. Okay, remember previously I told you that a drug, whether it is for IM, for topical especially, it cannot be 100% lipid soluble. It must also have a bit of hydrophilicity or aqueous solubility so that it can dissolve in the fluids at absorption site. Especially the transdermal patch, okay, topical, apa lagi? Even the oral preparation, yeah? Okay, any questions so far? So ideal for absorption, high lipophilicity with little hydrophilicity to cross lipoidal membrane into systemic circulation. Okay, the second factor, blood flow to absorption site. Intestine versus stomach. Okay, which one have more blood vessels?
Intestine.
Right, so that absorption is favored inside intestine. And then the third factor, total surface area. Intestine have more surface area compared to stomach. Okay, because it has microvilli, which is tenfold compared to stomach. So it has more surface area for absorption. Fourth factor, contact time at absorption surface. If drug move through GI tract very quickly, like diarrhea, so absorption is very poor. Okay, because most of the drug will be excreted fastly. Okay, so that absorption will be poor. And then the fifth factor, expression of P glycoprotein. Okay, what is P glycoprotein? So it is a transmembrane efflux transporter protein. Efflux means that any drugs that comes into the organ, okay, diffuse or absorb into the organ, this protein, this P glycoprotein or PGP, will export back to outside of the organ. Okay, it is transmembrane efflux. Maknanya dia daripada dalam organ, dia ambil it will take the drugs back to the outside of the organ. So that if P glycoprotein expression is high in certain sites or in certain organ, so the absorption in that site or that organ will be limited. Okay, this protein or this P glycoprotein, it has its own function to secure our body or our membrane, our organ inside our body. Okay, so the presence of P glycoprotein will limit the drug absorption, transport out the drugs and other molecules across the cell membrane. Okay, these are the distribution of P glycoprotein in our organ. Okay, in the liver, P glycoprotein is important to transport drugs into bile for elimination. Okay, to detoxify our body. So the liver works with help of P glycoproteins. In placenta, it transport back the drug into maternal blood and reduce the fetal exposure to drugs. Okay, dia nak lindung baby daripada diekspos kepada dadah berbahaya. Okay, and then in brain capillaries, it pump back drug into blood to limit the drug from access the brain. And then in kidney, pumping drugs into urine for excretion, and intestine, transport drug or xenobiotics or any toxic to intestinal lumen for that it can reduce absorption of the drug or the toxic materials to the blood. Okay, so any sites or organ that contains highly expressed P glycoprotein, the absorption at that site will be limited or very low. Any questions so far?
Doctor?
Yes.
Okay, for the P glycoprotein, right?
Yes.
It only take place whereby it only express when there's an overdose of drug, is it? Or if the drugs bring harm towards the human body, is it?
It already expressed in certain amount already in the organ. Okay, it's already there. Not because of our body exposed to toxic, then baru dia punya expression will be high. It's not like that. The amount of P glycoprotein is already standardized in each organ.
But when it express, right, it's only will begin to express once we have enough dose of drugs of it, or is it like what actually?
Maybe it has limit. The drugs can absorb into the organ in certain amount only. The P glycoprotein act as the guardian, or the apa ni? Dia akan limit the drug absorption in the certain organ. Am I answering the question?
Yeah. Thank you, doctor.
Okay. After this, we can discuss again. Okay, after this. All right. So the most important thing in absorption is the bioavailability. Okay, it depends on the mode of drug administration, right? So bioavailability is the fraction of drug administered that reach the systemic circulation. Means here, it means the unchanged drug that reach the systemic circulation. Example, we can calculate the bioavailability whether from values that are given to us, or we can plot a graph. Okay, this is the first method where we have the value. Example, we have 100 milligram drug administered orally, and then we found that only 70 milligram drugs are absorbed unchanged. Okay, we know this by measuring the drugs inside blood that we draw. Okay, we draw the blood and then we calculate, we measure the concentration of the drugs inside the blood. So we know it is 70 milligram. So we can calculate here the bioavailability is only 70%, okay, or 0.7. Bioavailability is very important in order to calculate drug dosage for non-IV routes. Okay, first pass effect. Again, you can see the picture here. You all already understand, right? What is first pass effect? So IV have bioavailability 100% because it bypass first pass effect.
Doctor,
Yes,
unmetabolized drug tu maksudnya?
you can off one of your device. You pasang banyak device
Unmetabolized drug tu maksudnya apa? Doktor?
Unmetabolized.
Maksudnya macam
Metabolize maknanya dia dah change the original form of the drugs. Maknanya dia dah tak sama. Means that we calculate for the bioavailability is the unchanged or unmetabolized drugs.
alright. Thank you, Doctor.
Okay. Okay, we can also compare the plasma level from any routes other than IV, and we compare with plasma drug level achieved by IV injection. This one by plotting graph, okay? Okay, let's say we give both by oral and IV routes. Normally, this one is calculated for developing new drugs, okay? When we develop new drugs, we have to calculate this. We have to calculate the bioavailability. So we test through IV, we test through oral, we can calculate the bioavailability of the drugs, okay? The drugs that are available commercially right now, we already know, okay? The bioavailability of the drugs has already been determined. So we know. But for new drugs, in the process of making new drugs, we have to calculate everything, including bioavailability. So this is how we calculate. We have to measure the ratio of area under curve of oral drugs divided by area under curve of IV routes. Okay, you still remember additional maths, how to calculate area under curve?
We need a formula, doctor.
Yes, actually, but we will not ask you such question, just for you to understand what is actually bioavailability. Okay, there are two ways when we are given value, we can calculate. Okay, just now. Okay, this one. For example, if you are given bioavailability value, for example, 70%, and we give you the amount of drug unchanged, absorbed unchanged, you can calculate the initial drug that has been administered orally, right? same if I give you the bioavailability values and I give you the initial amount of drug, you can calculate the absorbed drug unchanged. The drug that has been absorbed unchanged, you can calculate. Right. So this one we use curve, area under curve. Normally, if I want to ask you, I will just give you the value so that you can calculate. Okay, we go to factors that influence bioavailability. So mostly, anything that influence absorption will also influence the bioavailability. Okay, except for first pass effect. If drugs have first pass effect, so that percentage of bioavailability will be low. Okay, and then factors of that influence bioavailability, the solubility of drug. Okay, this one is also same to absorption just now. Hydrophilic, pH, hydrophobic, right? That is the solubility of the drug. Okay, hydrophilic drugs are poorly absorbed. Usually, hydrophilic drugs are prepared by IV preparation. And then extremely hydrophobic are also poorly absorbed because it can't access the surface of the cell. This is because the surface of the cell is a bit aqueous, right? Okay, ideal for absorption are largely hydrophobic with some solubility in aqueous. That's why many drugs are weak acid or weak bases. They are highly absorbed by cell membrane. Okay, the chemical instability, unstable in pH of gastric content will be low absorbed or then low bioavailability. Okay, penicillin G, unstable in gastric pH, so that penicillin G is available only in IV preparation. After this, you find out what type of penicillin that can be taken orally. Okay. Boleh? Your homework. Right, we have many type of penicillin. Okay, penicillin G is in IV preparation. All right, and then insulin destroyed in GI tract by degradative enzymes, so that insulin are given by, ingat lagi? SC or IM?
Yes, doctor?
I see.
Subcutaneous. Yes, because insulin is destroyed by degradative enzymes inside the GI tract. That's why it is available only in IM preparation. IM, subcutaneous preparation. Okay, the other factors that influence bioavailability, the nature of drug formulation. Absorption might be altered by factors that are unrelated to chemistry of drug. The nature of drug formulation influence it is highly absorbed or not. Okay, for example, the particle size of the drugs, the salt form, enteric coating, the presence of excipients like binders, dispersing agent. These excipients can alter the dissolution of the drugs and can alter the rate of absorption, and eventually alter the percentage of bioavailability of the drugs. So for bioavailability, any factors that influence absorption will also influence the bioavailability, plus the first pass effect. So this one is also factors that influence the absorption and also bioavailability. Okay, the particle size, the salt form, enteric coating, excipients of the drugs like binders, dispersing agent. Okay. Okay, rehat sebentar. Tolong scan attendance. Is there any problem with your attendance? Boleh tak dia capture tak your attendance?
Boleh, doctor, but just give us 1-2 minutes, huh?
Okay.
Can doctor?
No problem, huh?
Yes.
Can I proceed? Or you need more time? After this, I will show again. Okay. We go to the second component of pharmacokinetics, which is distribution. Okay. Distribution is a process which drug reversibly leaves the bloodstream and enters the interstitium, which is the extracellular fluid, and then enters the cells of the tissues. Okay, in other words, after we administer the drugs through any mode of administration, eventually the drugs will enter the bloodstream, right? Okay, absorption of the drugs. Okay, absorption will consists of movement of drugs from site of administration to the bloodstream. Okay, and then distribution is the movement of the drug from bloodstream to the interstitial and then to the cells. Okay, what is interstitium? It is extracellular fluid. Okay, after this, you will learn about volume of distribution, right? Our last objective of the lecture today, volume of distribution. Okay, the VD or the volume of distribution involve these three important compartments in our body, which are the blood vessels, the interstitium or extracellular fluid, and then cells. Okay, when the drug enter our body, it will be distributed into these three compartments. First, blood vessels, and then interstitial or extracellular fluid or extracellular place, and then the cells, inside the cells. Okay, any questions so far?
No, doctor.
Okay. This graph shows the distribution phase and also elimination phase. Okay, we can see here, I just want to show you the distribution phase, this rapid fall, okay, of the serum concentration of the drug. Okay, if you see this rapid fall trend, it is the distribution phase. So the exponential decrease is the elimination phase. Okay, we go to factors that contribute to efficiency of drug distribution. Okay, first one, the cardiac output or the regional blood flow, the capillary permeability, the degree of drug binding to tissue or plasma protein, hydrophobicity of the drugs, and also volume of distribution. This factor, hydrophobicity, also the factor of the absorption and also bioavailability. Okay, remember, hydrophobicity of the pH or the pH of the drugs is very important in drug absorption and also drug distribution. Here we go, one by one. The blood flow. We have to know that every organ in our body have different blood flow. Okay, the blood flow is very high to the brain, liver, and kidney, moderately to skeletal muscle, and very low flow to the adipose tissue, skin, and also viscera. Viscera is blood vessels that surround the organ. Okay, second factor, capillary permeability. This is determined by structure and chemical nature of the drugs. It varies between organs in terms of fraction of basement membrane, okay, the endothelial cells that wrap the blood vessels. Okay. We see here example. These are the endothelial cells. Okay, these are example for the liver, blood vessels in liver. Okay, so in blood vessel of the liver there is slit junction. Okay, so this is called cell permeability, where the drugs can go out or in to the blood vessels easily because of this slit junction. This means even for drugs that is not lipophilic, it can go through this slit junction. Okay, basement membrane is exposed due to large and discontinuous capillaries through so that large protein can pass. Okay, different with brain capillaries. Okay, because the endothelials have no junction, have no opening junction or the slit junction like the in the liver, so that drugs that can enter the brain capillaries is very limited, right? Only drugs that have properties like lipophilic that can enter the membrane of the endothelial cells. It can cross the membrane, okay? So that only certain drugs can enter the vessels in the brain. Okay, in the brain, capillary structure is continuous, no slit junction. Drug must pass through endothelial cells of capillaries in central nervous system by actively transport carrier, or the drug itself must be lipophilic, okay, so that it can cross the membrane. Okay, some drugs can enter the blood vessels of the brain through carrier protein, okay, only. So that what is the important things here, the important point here, drug that can enter our brain is very limited. Okay, example here is levodopa. Levodopa, this drug only use the large amino acid transporter carriers, transporter protein, okay, to enter the blood vessel in the brain. Are you confused? Oh, okay. I think this one is actually simple.
Okay.
Yeah. So lipid soluble drug readily penetrate into CNS because it can dissolve in membrane of endothelial cells of the brain blood vessels. Ionized or polar drug cannot cross endothelial cells because of the tightly juxtaposed cells that form the tight junction of blood-brain barrier. Okay, the tight juxtaposed cells actually the blood-brain barrier is called blood-brain barrier. Right. Okay, the next factor, the binding of drugs to plasma and tissue proteins. Inside the blood vessels, some drugs can bind to plasma protein. So when the drugs bind to the plasma protein, it will form a complex, a bigger complex. So this complex usually cannot diffuse or cross the blood vessels membrane. Okay, examples. Okay, the bilirubin, albumin bilirubin, normally it compete, okay, the bilirubin compete with certain drugs, so drug will bind to albumin. Okay, in this case, this drug that bind to albumin, it can be a drug reservoir because it like slow release type of drugs, okay, inside the blood vessels. So this complex of protein drug can prolong the activity of the drugs. Okay, the second binding is between drug and tissue proteins. Okay, just now plasma proteins, and we have to know that drugs can also bind to tissue proteins. Okay, so when it binds to tissue proteins, these drugs can also be a drug reservoir in the tissues. Okay, it can also prolong the activity of the drugs. Okay, in certain case, the binding of drugs to the tissue proteins can accumulate the can accumulate the drugs in the tissues, and the metabolites of drugs in certain case can cause toxicity. Yeah, for example, acrolein, which is the metabolite of cyclophosphamide, can accumulate in renal cells and cause toxic to the kidney. Okay, any question so far? Okay, the fourth one. Same thing, the hydrophobicity or lipophilicity. Okay, we discussed already previously. So the fifth, the important factor is volume of distribution. Or if VD is high, means that the drug is highly distributed into the body. Okay, so VD is the calculated body space available for distribution of a drug. Okay, it varies between individuals. Some people maybe the VD values is very low. Okay, because the drug cannot be distributed into 100% of the body compartment of that person. So the VD will be low. Okay, the formula of the VD, it is the amount of the drug in the body divided by plasma concentration at time 0. Okay, how we calculate this? Okay. Okay, for example, we administer drugs to a patient, and after 1 hour, after every 1 hour, for example, or every 2 hours, we draw their blood. Okay, we draw their blood, and we can measure the concentration of the drugs in each hour that we take the blood. Okay, we see here, we can plot the graph, concentration of the drugs at 2 hours after administration, 4 hours, 6 hours, 8 hours. These are the examples. We draw the bloods after we administer the dose. Okay, then we can extrapolate the graph to the y-axis here to get the plasma concentration at time 0 or C0. Okay, because we cannot measure immediately after we administer drugs. Okay, because we don't know the absorption capacity of each individual, right? So we wait until 1 or 2 hours, and then we draw blood. We calculate the concentration of the drugs inside the blood, and then we can plot a graph to get the concentration at time 0 here. So in this case, 1.8. These are examples. Then we can calculate the amount of the drug that we give initially to the patient, and we can divide by the plasma concentration at time 0. So we can get the value of volume of distribution for the drugs in the patient. Any question? Okay, if the dose is 5 milligram, the blood samples have concentration of the drug 1 milligram per ml. So we can calculate the VD by we divide the dose, we divide by plasma concentration at time 0. Any questions so far?
Doctor, can you repeat the extrapolate the beta phase back to time 0 to get the hypothetical concentration, which is 1.8 UG per milliliter?
Okay, this is not for this calculation. Okay, this one is other examples. If we for example, we give initial dose to a patient, whether by IV or by oral administration. Okay, we give the drug to the patient. We know the dose, right? After 1 hour or 2 hours, we have to draw the blood. Okay, we draw the blood at 2 hours after post administration, 4 hours, 6 hours. We draw the blood. Okay. Okay. Each time we draw the blood, we can measure the concentration of the drug inside the blood. So we can plot the graph. After we finish, take the blood, and we can plot the graph like this. We can extrapolate the line to the 0 value of the x-axis. Okay, here, so we can get the plasma concentration at time 0. After we get the plasma concentration at time 0, we can calculate the volume of distribution because we know the concentration of the first dose that we administer to the patients. So the dose that we administer, we divide by plasma concentration at time 0 or C0. So we get the volume of distribution. Okay, okay, ka?
Okay, doctor. Just want to reconfirm that.
All right. Why VD is important? Because we can determine the half-life of drugs. Okay, the volume of distribution also like bioavailability. We have to calculate this when we want to develop a new drugs. Any drugs that are commercially available, we already know, the pharmacists already know the VD, the bioavailability, everything about the drugs. Okay, this one is about, we calculate this when we want to develop a new drugs. Again, okay. So when we know VD, we can determine the half-life of the drugs and also the duration of the action of the drug inside the body. And we can also determine the best loading dose of the drugs to be given to patient. Okay. Any questions so far? I think I have given this slide in the e-learning website. Any one of you have a look or already read the slides? Okay, lecture kita dah habis. Thank you very much for your attention. And please, if you have any question, please ask now. So for the factors, the influence bioavailability, influence the absorption, anything that is relevant, if you will be given marks. So don't worry. Normally, I ask the factors. So for VD and bioavailability, you will be given the value. So you just have to remember the formula. Okay, no question?
No, doctor.
If you don't have question, then that's all our lecture today. Feel free to email me if you still have something to ask or discuss. You are most welcome.